Hi, I'm Dr. Raymond Fayad, and today I would like to talk to you a little bit about dental implants. Dental implants are artificial roots that are implanted in the jawbone to replace missing teeth. Typically, dental implants have a better prognosis, meaning they have a better success and longevity than bridges, which usually you would have to cut down the neighboring teeth to place a bridge, and sometimes those teeth are not root canal treated, so that means that there's a big possibility of damaging the tooth and its nerve. We usually recommend for an implant to be placed within a year, and the reason is that the bone in that space where the tooth was lost loses the most in the first year. We usually recommend for the patient to place implants as soon as possible due to the loss of bone in that area. So if we can imagine that the thickness of the bone is there because there's a root in the bone, then when the root is gone, then it collapses, and then we cannot place an implant in that space. Because the implants come in sizes, they have a length and they have a diameter. So depending on what tooth we're replacing, we have to look at the area that we're replacing and make sure that we place the right implant. The larger the implant, the better, because we're trying to cover the largest area possible for the bone to attach to the implant. So we look at some structures, for example, the sinus, and we look at the inframandibular nerve, and we try to stay away from these structures by getting a CT scan. The best time to place an implant would be within the first year of a loss of a tooth. But that does not mean that we can't place an implant in the future. It just means that maybe a patient would need a bone graft because they lost so much bone after the first year.